Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back, everyone. Today's topic, we are going to be talking about 3 signs that your period might not be normal. This is actually something that comes up in practice quite often because I talk a lot about menstrual health and help a lot of women with their period problems, because what I've come to learn is that your period might be normal for you, but the symptoms that you're experiencing are really not normal. So when I talk about these 3 things, I bet a lot of you out there will be like, oh my gosh, that is me. And I thought that this was normal when really it is not normal. So the first sign that your period might not be more normal is an abnormal amount of bleeding. So typically we will menstruate about 80 milliliters of blood during that 3 to 5, 7 days of our cycle, which equals about 16 teaspoons. So just imagine 16 teaspoons, which really, if you put it in a cup, isn't that much. And we can compare that to the size of our tampons or pads. And a normal tampon that is fully saturated holds about 5 milliliters. And then a super tampon or pad that's fully saturated holds about 10 milliliters. So over the course of time, if you were to have a normal amount of bleeding to equal the 80 milliliters, that would equal 16 fully saturated regular tampons or 8 fully saturated or tampons or pads, or the super tampons and pads. So this is throughout that entire few days that you're menstruating, roughly around 4 to 5 days. So I know some women in practice that are changing their super pad or tampon 3 to 4 times a day. So if you could be flowing through this like normal amount of menstrual flow in the first 2 days of your cycle. So keep that in mind. I doubt there are quite a few people out there that don't even have any idea how many products they're going through, but this is something that you can start to track. And if you're changing quite often, this is not normal. Also, too, with the abnormal amount of bleeding is if you're passing any blood clots that they're the size of a nickel or even like a quarter, this also is not normal. So we'll talk about reasons why this could happen at the end, but first I just wanted to get through the signs and symptoms of the reasons why your period might not be normal. So the first, like I just mentioned, is the abnormal amount of bleeding. And then secondly, if you're having terrible cramps, this is probably a very common symptom that I address in practice, and it should be normal to have tolerable is the word, cramps. These cramps should not affect your activities of daily life. They should not have you have to call out of work. They should not have you have to cancel plans. They should not have you want to be curled up in a fetal position all day. This is not normal. And if you're taking handfuls of ibuprofen or Tylenol, this is also not normal. Like I mentioned, you should have tolerable cramps. So you should feel a little bit of cramping in your pelvic region or your back. But again, you should be able to do all of the things. You should not have to call out of work. You should not have to feel ill, etc. So if you're having terrible cramps, this is a sign that things hormonally are going on and we need to address them. And thirdly would be your cycle length. So the average woman has a cycle when they're menstruating about 4 to 5 days. Up to 7 days really isn't normal. So if you're around that 3 to 5 days is kind of like where I like to see it. And also too, we look at the entire cycle length. So day 1 to day, again, the day you start bleeding again, which is typically anywhere from 26 to 32 days. But what's important to notice here is that you need to be consistent. So we can't have a few days or a few months that are 26 and then you have a 33 and then you have a 28 and then you have a 36. Like that is not normal. So it needs to be consistent for you anywhere between that 26 to 32 day of the menstrual cycle length. And then within that, your actual menstrual phase should be about 3 to 5 days. If it's any more than that, 6, 7, especially if you're having multiple days of heavy bleeding, this is not normal. So what could be the cause of some of these issues? Well, likely it is your hormones. Likely is too much estrogen or too little progesterone, or maybe you have enough progesterone and too much estrogen. So that's where testing comes into play. And I like to test women on their menstrual phase, days 19, 20, or 21 of your cycle. So if you're listening to this and you're like, oh my gosh, you're speaking to me, ask your doctor for a hormone test and then specifically get them drawn on day 19, 20, or 21 of your cycle, regardless if your cycle length is short or long, because then we can see where the imbalances are. And then we also want to look at our thyroid. So our hormones are all on this axis called the HPA axis: your thyroid, your adrenals, and your sex hormones. And your thyroid plays a giant role in your cycle length. And I'll give you a personal example about what happened with me and my cycle and my thyroid. So last year we had a doozy of a year. 2020 threw us all for a loop. And in July, I started noticing like my hair was starting to fall out. And then in September, I had a 45-day cycle. And this is absolutely, completely abnormal for me. I'm usually 28 days on the button, maybe 27, but usually right around 28. So to have a 45-day cycle for me was totally not in the normalcy for me. So I, of course, was stressed. I'm like, what is going on? No signs of pregnancy, no chance of that. Like that was not the case, but my cycle was so long. And I had just gotten my labs drawn prior to that, probably the cycle before that. And my hormones were actually, or sex hormones were actually perfectly spot on. It was my thyroid that was an absolute mess. And it actually likely threw off my cycle that month, which I've never experienced. But it just goes to show you that it may not be your sex hormones. It might be your thyroid, or it might be your adrenal glands. And I think it was the stress of everything that was going on in 2020 that affected the cycle. So that's why it's important to work with a functional medicine doctor or a naturopathic doctor so that you can look at that whole picture. And there's a lot of hormones that play a role, not only the thyroid, but then we have to look at, a few different forms of estrogen. It's important to look at estrone, estradiol, your progesterone, your sex hormone binding globulin, your testosterone, your DHEA, your LH, your FSH. Are you ovulating? If you're not ovulating, you're not making progesterone. And then, like I mentioned in the Thyroid 101, we talk about all the different labs for your thyroid and making sure you get a good look at that thyroid so you can see where the excesses or the deficiencies are going on with that thyroid, if it's underactive or overactive. So that can definitely affect some of these symptoms. But with like the abnormal amount of bleeding, terrible cramps, etc., like that's usually hormonal. It's likely due to estrogen or progesterone in some imbalance or excess of either one of those. But if you're having a longer cycle length, that could be affected by the thyroid, also the hormones as well. So that's where looking at the big picture is. So different forms of testing that you can do to see what's going on is I personally do the blood testing in office. And like I mentioned, we get tested on day 19, 20, 21 of your cycle. Or you can look into something called the Dutch test, which is a dried urine test for comprehensive hormones. You can order this yourself on DutchTest.com. And you can have the kit sent to you, and you actually get a really good explanation as to what's going on when you get your test results back. So it's not like reading a foreign novel. You can kind of understand there is a lot of things in there that are a little bit comprehensive as far as the terminology goes, but they do a really good job of explaining what's going on and signs and symptoms based on your blood and your data that you submit in. And then also I have a period course. I did this Master Your Cycle, Honor Your Embrace Your Hormones course that you could purchase to go through everything about your cycle, learn everything about it, from what happens during each phase of your cycle, where things go wrong, where your hormones can go unbalanced, etc. And I do offer a testing through there that you can purchase that gets you the results more comprehensively as far as you can do with thyroid, you can do your adrenals, you can do your sex hormones through this test. And it gives you the education behind it to explain what is going on for you. So those are a few different options, and we'll have that linked in the show notes as to how you can access these items. But this is a common discussion that comes up in practice, and I wanted to just teach and educate more people about it. And again, we'll recap the 3 signs that your period might not be normal is the abnormal amount of bleeding. So you should be bleeding about 80 milliliters, about 8 fully soaked tampons if you're using the super a month. Anything over that, if you're passing clots and having more bleeding, is not normal. If you're having these debilitating cramps that are affecting your activities of daily life, this is also not normal. And then your cycle length, if it's any more than 32 days, if it's less than 26 days, but more importantly, if you're ping-ponging between short and long, that is not normal. So anywhere between 26 to 32 days of a cycle is normal. And then bleeding, your menstrual phase should be about 4 to 5 days. 3 to 5 days, anything more than 7 is really not normal. So again, test, don't guess. You can have a lot of speculation after listening to this as to what's going on, but we really want to get some answers for you. So find a doctor that will run some hormone testing. Look at the Dutch test. You can check out my period course and get all of the information you need. So yes, that is this week's episode. If you found value out of this or know someone that wants or needs to hear this episode, please screenshot it, share it, tag me. I will answer any questions that you might have. And I look forward to seeing you next week, where we're going to be talking all about why you need IV therapy. Stay tuned. See you next week.